and you can let your head down. Hey, you gotta keep your head up. Oh, and you can let your head down. Hey, I know it's hard. No, it's hard to remember sometimes. But you gotta keep your head up. Oh, and you can let your head down. Hey. I got my hands in my pockets, kicking these rocks. It's kinda hard to watch this life go by. I'm buying into skeptics. Skeptics mess with the confidence in my eyes. I'm seeing all the angles, thoughts get tangled. I start to compromise my life and my purpose. Is it all worth it? Am I gonna turn out fine? Oh, you turn out fine. Fine. Oh, you turn out fine. But you gotta keep your head up. Oh, and you can let your head down. Hey, you gotta keep your head up. Oh, and you can let your head down. Hey, I know it's hard. No, it's hard to remember.
Good evening, and welcome to Urban Health's Committed to Community event. Thank you for joining our interns and service partners in celebrating their accomplishments this summer and helping us to highlight the impact they have made through their work over the past 8 weeks. My name is Eunice Agyapong.
And my name is Maddy VandenBrink.
We have the honor of serving as Urban Health Project's co-directors for the 2020-2021 academic year. I know that I speak for both of us when I say we are both humbled by the legacy of those who came before and thrilled to guide this unique program through another successful year of growth, service, and commitment to community.
As you know, Urban Health Project is an independent, student-run nonprofit organization founded by UC medical students in 1986. Throughout our 34-year history, we have been guided by a vision of improving healthcare by inspiring medical students to have a personal connection with the social determinants of health. We achieve this by working with underserved communities and nonprofit organizations in the greater Cincinnati and Northern Kentucky areas. Through this work, we hope these future physicians will use the knowledge gained from their UHP experience to provide better care for all populations, especially the underserved. Our mission is to educate, inspire, and challenge medical students to become more engaged through service.
When UHP was founded in the late 80s, the College of Medicine curriculum was very different. Like the vast majority of medical schools, students focused only on basic science and anatomy courses. They rarely scratched the surface of the human context in which medicine is practiced. Our founders, hoping to bridge the gap between the classroom and the clinic, started UHP to challenge themselves and future colleagues to step outside their comfort zones and learn more about the community. While the College of Medicine has greatly improved how it addresses the gaps between medical education and the social determinants of health, Urban Health Project's vision remains as relevant as ever, learning through service.
This year, the COVID-19 pandemic has drastically altered the social and economic structure of our community. It has left many individuals in the greater Cincinnati area without the resources they previously relied on, and has left many organizations with the need to decrease the capacity of people they can serve. With social distancing measures, much more of the population has been isolated from society, thus leading to higher rates of depression and other mental illnesses. Unfortunately, but not unexpectedly, the underserved populations with whom many of our interns have worked with this summer have been disproportionately affected by the side effects of the pandemic. Many individuals in vulnerable situations or communities have been further trapped by the cycles of poverty, trauma, and depression that the COVID-19 pandemic has spawned.
This summer, our interns have been working harder than ever to understand the disparities that exist in our community and how the pandemic has further aggravated them. As medical students, it is necessary for us to not only appreciate why these disparities exist, but we must also have the empathy and social awareness required to combat them. In order to achieve this, UHP has partnered with community organizations that focus on serving vulnerable populations throughout the greater Cincinnati area. Our goal is to provide these organizations with support through service in order to help fulfill projects that may not have been completed due to lack of time, staffing, or resources. This summer, UHP has a total of 22 interns spread across 21 organizations in the greater Cincinnati and Northern Kentucky areas. Our service partners focus on outreach to marginalized communities, including people experiencing homelessness, those battling addiction and mental illnesses, refugee services, and advocacy groups. So far this summer, our interns have completed over 4,000 hours of service time, worked and engaged with over 4,000 members of the community, and provided an estimated $90,000 in community impact.
This summer, we have learned about the resources that our community partners provide to the diverse populations that they serve, and how these resources have been impacted by the pandemic. It has been a humbling and rewarding experience to speak with each of our sites about their missions and the challenges that they faced in this past year. Throughout the summer, we've also organized 2 educational community events. The first being a virtual social justice tour of OTR with the Greater Cincinnati Homeless Coalition, and the second, a summer book club discussion with our board member, Dr. Joseph Kiesler. These events have helped contextualize some of the social and political challenges our interns have witnessed throughout the summer.
At this point, we will begin our program with presentations from our interns on their summer internships and the projects they've developed. After the presentations, we'll take a short intermission, followed by our keynote speech from Dr. Neel. We will conclude the event with our award ceremony. Our first presentation will be from Xenia Ivanova, who has worked with the Alzheimer's Association this summer. Xenia, take it away.
Hi, everybody. Like they said, my name is Xenia Ivanova, and I was working with Alzheimer's Association of Greater Cincinnati this summer. And one thing that I did was I made a survey on the effects of COVID-19 on people with dementia and their caregivers. So I decided to do that because people over 65 are particularly susceptible to complications from COVID-19, as you can see on the graph on the right. And also, people with dementia tend to be over the age of 65, so they're at high risk. And a lot of them are living in facilities that have limited or banned visitors during COVID, and they don't have access to the technology that a lot of us have been using to communicate during this time. Also, caregivers tend to be older and face a lot of the same obstacles that I mentioned because of COVID. So one of the resources that caregivers had was Alzheimer's Association, and they had to virtualize most of their resources because of COVID, but they're not sure if people are accessing these resources or if they're as good as the in-person events that they've been having. So we wanted to do a study to find out how people are using Alzheimer's resources and virtual resources, and how COVID has affected the way people have been interacting with persons with dementia, and how people's lives has changed because of COVID. So we did a 20-question survey on Google Forms, and we sent it to about 2,000 emails, and we posted a link on social media, and the survey is still open. So we're still gathering results, but a couple of things that we found out was that almost everybody thought that quality of life for persons with dementia was decreased because of COVID, which makes sense. And caregivers were spending time through barriers or video calls instead of in person, but most people still spent a lot of time in person despite the quarantine measures that were suggested. And people are not using Alzheimer's Association resources because of COVID. They were not aware that they were virtualized. So this will really help Alzheimer's Association advertise and make new programs, and it can be used by other chapters across the nation. And I'd like to thank everybody at Alzheimer's Association, UHP, and also Dr. Schladecker for helping me with this.
Hi, everyone. I'm Mara Kopchak, and this summer I worked with Bethany House Services. Bethany House Services is an emergency homeless shelter for families in the Cincinnati area. We currently serve about 36 families, but our normal capacity is between 40 to 50 families. And we usually have them split between our 2 apartment sites and then our 2 communal living sites. However, due to COVID, we've had to move the communal living sites to hotels to better social distance everyone. So a few of the things I've been working on this summer is I worked as an interim case manager and taught several different life skills courses. I also went on housing inspections and tours with some of our clients and helped them with like resumes, applications, anything like that that they really needed, and then connecting them with like local resources, which was interesting because a lot of them are, you know, not as active and have limited hours because of COVID. But the two main projects I worked on this summer is I created a booklet and a bunch of posters to help teach our clients about health and help them better advocate for themselves in a health setting. So this went from like family planning and sexual health all the way down to the most common childhood illnesses. And we distributed these to all of our residents. And then I also created resources that had medical, dental, mental health, and food resources with addresses and phone numbers for all of our clients so they could better advocate for themselves and access those resources even beyond Bethany House. The other project I worked on was elevating the voices of the homeless population. This was done through a series of discussions with our clients about their experience with homelessness in general, their experience like with homelessness specifically during the pandemic, and then their experiences with law enforcement, city officials, and then also physicians. And so through those discussions and then city council, we also registered a lot of people to vote and kind of help people understand that their voice could change the lives of their kids and other people who are also experiencing homelessness. So it was more empowering them to learn and use their voice. I would like to thank Urban Health Project for all their support throughout the summer, and then also the staff of Bethany Health Services for welcoming me with open arms and teaching me a whole bunch this summer.
All right. Hi, everyone. My name is Joel Facer, and I spent my summer working with the Center for Addiction Treatment here in Cincinnati. It is a service that treats both outpatient and residential patients dealing with drug and alcohol addiction. For most of the summer, my time here was spent working with the residential patients, both assisting with the primary care and working on a chart review project. Multiple providers there during initial conversations about the nature of this project said that they wanted to see a review done of the standing medication order sets for their residential patients. The goal being to make sure that they were managing symptoms of withdrawal as effectively and quickly as possible to prevent patients during those critical first few days from discharging against medical advice and returning to use patterns instead of sticking out through the detox process. With this goal in mind, the majority of my project was a chart review of 5 weeks worth of patients, 347 bed days, 52 patients in total, and this represented about 4,200 individual medication doses. At the end of this review, we had a list of 7 potential adjustments to be made to their standing medication orders. This included 1 new indication to be added, 5 new drugs to be added, and 1 dose adjustment to an existing drug on there. To date, I think 2 of these changes have been made so far. The other 5 are under consideration, and it's my hope that in the long term, this will help lead to longer patient retention for the residential patients. Huge thank you to Laura Schatzman, the nurse practitioner with whom I worked for most of the summer, to Patty Webb in IT for getting me access, and to Maddy and Eunice here at UHP. I cannot think of a better way to have spent my summer. Thank you much.
Hi everyone, my name is Emma Clark, and this summer I had the opportunity to work for the Center for Closing the Health Gap on a project entitled The Impact of COVID-19 on Youth Mental Health Outcomes in the Greater Cincinnati Area. The Health Gap was founded in 2004 with a mission to eliminate racial and ethnic health disparities via a grassroots mobilization model that aims to engage, empower, and advocate for and with the African American community in Cincinnati. As you know, the novel coronavirus emerged in late 2019 and has spread rapidly across the globe. Because of this, widespread shutdowns have taken place, and the mental health of children living in quarantine may have been forgotten. The overall goal of this research was to take a closer look at the impact of COVID-19 on youth mental health outcomes in Cincinnati. To do this, I conducted 5 key informant interviews with the parents of children in a local Cincinnati Public Schools affiliated Girl Scout troop. The results of these interviews showed that most participants stated that their children exhibited no mental health concerns in quarantine. However, 40% of participants did state that they are concerned about their child's ability to handle stress, and further, 80% of participants stated that their child had expressed fear or worry about their own health and/or their health of their loved ones due to COVID-19. This is just a table of some of the question responses, but in the interest of time, we're going to move on. As I mentioned, participants were much less likely to directly express concerns about their child's mental health, but with prompting, they did indicate the presence of potential warning signs for mental health problems in their children. This is consistent with the current literature that shows that parents may be unwilling to discuss their child's mental health problems due to stigmatization and the fact that parents are often to blame for their child's mental health problems. I would like to thank UHP and the Health Gap for the opportunity this summer. Thank you.
Hi, I'm Grace Kelly.
And I'm Eunice. This summer, we were paired with the PPC, which is a federally qualified primary care clinic. However, due to COVID, we worked on several cohorts over Zoom this summer instead.
So we had many projects, our first project being the Patient Family Advisory Board, and we were basically looking at how children's hospitals across the country recruit and maintain their patient family advisory boards to help identify ways to create equitable and diverse boards. Our survey has been sent out, but we are still waiting on responses. Our next project was looking at patient-family experience. So preliminary studies have shown that minority populations feel less safe in the hospital compared to their white, rich counterparts. And so we were trying to identify reasons that this may be. So far, our results have not shown any correlation between questions on their overall experience and their safety, but we are still looking for particular questions that correlate well. We also worked on messaging, so we created a YouTube video about heat stroke in children, and we also created social media infographics about COVID for young adults. Our main project was looking at voting. So voting is a marker of social capital or a social determinant of health, and then children's health outcomes. The second part of this project was how to promote voting through primary care clinics, and we helped with promoting voter registration and absentee ballot requests through infographics as well as posters. So results from our study on voting, which we received today, show that inpatient bed days correlate pretty strongly with the percent of people who vote within a census tract, and that there is almost no correlation with hospitalizations, period. We are still waiting to do further studies, such as controlling for socioeconomic status, to look at just the results of voter turnout.
We would like to thank our advisor, Dr. Beck, and Eunice and Maddy at UHP. Thank you so much.
Hello, everyone. My name is Nimi Gupta, and this summer I worked with Cincinnati Youth Collaborative, which is an organization that that helps empower young children in the Cincinnati area. And with them, I also worked with Med Mentors, which is an organization that helped pair medical students with mentees in the Cincinnati area. Let me see if I can get this working. Oh, there we go. So my project this summer was to see how cultural competency improved in mentors in the Med Mentor program. And I did this with a survey that was given through to mentors prior to starting mentoring and then after mentoring. So the questions that were given were about cultural knowledge, cultural skills, and cultural encounters. And then this is a table of who completed the survey. So you can see that there are a lot less post-surveys that were completed, and that's something we're working on improving for the future. And here are some of our results. So as you can see, cultural knowledge average answers actually increased the most, and then cultural encounters stayed like pretty flat. So that kind of shows that mentoring actually helps improve the cultural knowledge aspect of cultural competency. And we also separated it by demographics, but we don't really have a ton of time to talk about that right now. So overall, in the future, we're hoping to statistically analyze each individual question and see how med mentors are growing in cultural competency. And we're also just hoping to supplement cultural competency growth in med mentors, but also in medical students overall, because that being culturally competent is an important part of being a physician. And I would like to thank Dr. Cavallo for helping me with this project and providing all the data. And then I'd also like to thank CYC. I did a lot of different projects with them as well that I didn't get to talk about today, and it was a really great experience. And of course, I'd like to thank UHP for giving me the opportunity to have this internship.
Hi, everyone. My name is Matt Altman, and my community partner this summer was the City Gospel Mission. The City Gospel Mission is a ministry in Cincinnati that's nearly 100 years old, founded in 1924, with the mission of helping individuals break the cycle of poverty and despair. City Gospel Mission is a fairly large organization. It has many programs that help individuals at all stages of life. That includes the Little Village for Children, an addiction recovery program, as well as a shelter for the homeless. This summer, I worked in the homeless shelter portion of City Gospel Mission. The shelter is also very large. It holds 74 residents usually. However, that capacity was reduced to 70 to allow for some distancing in the bunk rooms. This shelter is unique compared to other shelters because residents are allowed to stay for up to 1 year. This makes it possible for residents to really lay down the foundation to make a sustainable transition out of homelessness as they work with the case manager. So while residents stay at the shelter, they're either required to have employment or they can take part in a day program where they complete courses and complete activities to earn points to stay at the shelter that week. So for my project, I taught health education courses as part of the day program. Courses were taught multiple times per week. I focused on topics like chronic illness, nutrition, as well as a weekly COVID-19 discussion. Eventually, COVID became my primary focus because, as you might expect, it was a pretty hot topic around the shelter, and there were a lot of differing opinions. So these talks were really well received. Every time we maxed out the capacity of the classroom, residents were really engaged. They asked a lot of questions. People regularly stayed after to continue these discussions. And my main focus was really just to try and explain why masks and social distancing were so important. And after these talks, I did notice that some residents began to wear masks and try and distance around the shelter, which they were not previously required to do. I'd like to thank Kalagoli, as well as the rest of the staff at City Gospel Mission and the Urban Health Project for allowing me to have this experience this summer. Thank you.
Hello, my name is Nosa Osagede, and this summer I worked with Cradle Cincinnati. My project centered around the Cradle Cincinnati Learning Collaborative, also known as CCLC, which was created as a way to unite health centers and community care teams to transform prenatal care in Hamilton County. It is based on the Institute for Healthcare Improvement Collaborative model with the premise that the most intensive frontline improvement work happens in collaboratives, which means when organizations committed to a common goal through shared learning can achieve sustainable change. So the CCLC is made up of approximately 24 teams across multiple organizations, and they're focused on four key areas of prenatal care, which are, and you can see those on the poster here, they're first trimester access to prenatal care, effective smoking cessation, integrating community health workers, consistent team-based prenatal care model, including the population health principle. And the purpose of this project was to analyze the implementation of the four focus areas using a survey and identifying ways that Cradle Cincinnati could best support its teams in meeting the collective goals. So the results showed that several sites were implementing at least 2 or more key drivers simultaneously this past year, and the most common of them being effective smoking cessation. And that was achieved through the strategy of teaching staff how to identify and counsel women on the 5 A's of smoking cessation. And it was also interesting to find that despite teams reporting that they didn't have access to data and reports that teams were unfamiliar with the data portal, it's encouraging to see that all teams were still working on implementing key drivers in their practice and also incorporating community healthcare workers into the team-based care approach. So I would like to thank Lauren Everett, Jessica Seaberger, the CCLC team, and Cradle Cincinnati for allowing me to work with them this summer. And it's been such an enriching experience for me. And I would also like to thank Eunice and Maddy for all the work they've done in coordinating all the things we've done this summer. They did a great job, and thank you.
Hey everyone, I'm Kyler Wilson.
I'm Alex Gelati.
And we have a third intern, Ashley Mills.
Sorry, I was muted.
All good. So the three of us interned at Crossroad Health Center this summer working on 2 projects. Our first project was Ashley and I's doing some volunteer work with Crossroad Health Center's COVID testing.
Essentially what we did was we processed all the paperwork for the first 2 days of COVID testing. It's about 800 paperwork, called patients who were positive to check up on them, and then tabulated PCP data against the novel antigen test.
So I want to point out, there's a lot on this slide, but I want to point out that 868 patients were tested across the 2 days of COVID testing CHC performed, and then during the first day, 17% of the antigen tests were positive, and then the second day, 7% of the tests were positive for COVID.
Overall, what we noticed was that there was a lack of communication between the Ohio Health Department and CHC and other COVID testing sites, and that everything was done in paper form, despite CHC's commitment to trying to contact patients with test results and speedy workflows. What future considerations would be: 1, transfer from paper form to an electronic documentation, and then set up a liaison between the two, especially during times of pandemic.
And then our second project here was working with administering social determinants of health testings to adult CHC patients, which we then analyzed.
Just to be brief about what we did, we called about over 1,000 patients and gave a survey of 13 questions ranging from housing needs to interpersonal abuse and violence. Patients who said they did not need anything were considered no-need patients, and we treated them as our controls. And all this data was collected based on responses, tabulated, and analyzed.
So what we found were the top zip codes and physician providers at CHC with the largest population of patients most at need. And then we also identified 3 of the top needs reported, which were food, transportation, and safety and abuse. Next slide. The image, this image here is just the outreach of our results and the patients that took the survey and get care at Crossroads. This kind of led us to develop kind of a flagging system for Athena, which is Crossroads EHR, to allow patients most at risk based on their zip code and the provider they're seeing to be flagged so they can be more efficiently administered the survey, as well as we noticed some limitations as to who is given access to the survey. Preferably only English-speaking patients are able to give this. So what we did is we also translated all of the resources into Spanish, as well as the screening, and set up a volunteer program with the medical Spanish program here at UC, so that Spanish-speaking patients can receive this survey as well. We'd like to thank Caitlin Chrisman, Dr. O'Day for their support and guidance through both projects, as well as Brian Weiner, who assisted us with analyzing our data, and then UHP, Eunice and Maddy, for their support and allowing us to be interns here at UHP.
Hi everyone, my name is Tessa Kaiser, and I interned at First Step Home, which is a residential treatment facility for women with substance use disorders that caters especially to the needs of women who are pregnant or have young kids. FSH is not licensed as an acute drug detox facility because it does not have 24-hour medical staffing. In my internship, I've been able to work on site where I start each day by helping to monitor the dispensation of buprenorphine, a medication for treating opiate addiction. I then spend most of my day assisting Nurse Jennifer Dawson with various care coordination activities. When the maternal and fetal medicine physician, Dr. Michael Marcotte, is in the building twice a week to provide obstetric care and manage buprenorphine prescriptions, I also assist with these appointments. And in addition, I have led several group sessions with clients on various health topics. For my project, I decided to focus on promoting smoking cessation. The majority of clients at FSH do smoke, and I wanted to help create a more supportive environment for non-smoking. So to start, I interviewed clients about their smoking habits and gathered feedback on how FSH could better support women trying to quit. I found that most smokers did want to quit, and the common barriers to quitting involved stress, boredom, and being around other smokers. I then pursued initiatives to address the expressed needs. So first, I designed a handout listing websites and apps that help with quitting. I also gathered input on the outdoor non-smoking area, and based on this feedback, the administration added umbrellas over the picnic tables in this area to provide more shade. Finally, I helped develop a new initiative to distribute wristbands and custom-designed t-shirts to clients who quit smoking. Overall, my experience at FSH gave me a better understanding of the nature of addiction and the difficult process of recovery. I hope that my project will enable more women to build healthy lives free from all forms of addiction. Thank you to UHP and to the staff of First Step Home, especially Nurse Jen and Dr. Marcotte, for this learning opportunity.
Hi everyone, my name is Evan Gies. My project was addressing food insecurity with a produce prescription program. So my site this summer was the Good Samaritan Free Health Center, and it is a free clinic located in East Price Hill for the uninsured adults who are living in Hamilton County. So food insecurity is an issue in Cincinnati. About 33% of families in Cincinnati do suffer from some form of food insecurity, and those numbers are only accentuated by the COVID-19 job loss. We do have some food in our waiting room, but often it's not enough for patients who don't frequently come to the clinic for their appointments. So to combat this, we started the produce prescription program. We've been screening all of our in-person visits for 2 standardized questions, asking about their scarcity and worries of food on the table. If they do screen positive, we do offer to enroll them in our program. It's a 9-month program, and our patients will receive 1 produce prescription, which is like a gift card, per month to the Healthy Harvest Mobile Market, which is a collaboration with the Free Store Food Bank. It's a mobile market that travels throughout the city to give fresh fruits and vegetables. So far, we've noticed about 27% of our patient visits have screened positive, which definitely highlights that this is an issue within the clinic. So we do have some early data. It is a 9-month program, so it is ongoing with our data collection. These are some of our data points that we do collect, and we have noticed so far that our patient demographics do match the cohort demographics, including the notable 44% that are Spanish speaking, which matches our approximately 50% patient volume that is Spanish speaking. We do notice some early trends here. We looked at fruit and vegetable consumption throughout the week, and we did notice that Spanish-speaking patients do have significantly higher fruit and vegetable intake. And we've also correlated the BMIs of our patients with their fruit and vegetable consumption. And these have been some interesting trends that we'll continue to monitor. Overall, we've noticed that transportation is a pretty big issue for people in the city. Because the market is mobile and there are only a handful of locations, it's hard for our patients to be able to get to the market on a consistent basis. We have also noticed that people are pretty enthusiastic about the program and have noted that healthy foods can be affordable and can be powerful influences on their health. So in the future, we're going to continue our monthly data collection to monitor participation, and we'll continue collecting patient statistics at the end of the year. I'd just like to thank Free Store Food Bank and all the staff at the Good Samaritan Free Health Center for helping me get this project rolling and teaching me a lot about the clinic. Thanks.
Hi, I'm Anna Edwards, and I worked at Meekum House, which is a safe haven for boys and girls aged 10 to 17 who are experiencing homelessness around Cincinnati. The average stay is 4 days, and while there, they're provided fresh meals, clothes, toiletries, and their own room, and they're surrounded by an extremely caring and supportive staff. I worked in person 3 days a week and used 2 days to create and organize activities. I held group activities each morning and afternoon, and the rest of my time was spent with the youth individually. Having at-home planning days allowed me to be 100% present and available when on site. And many of these teens experienced traumatic events that have shaped who they are. I spent time talking with them one-on-one and provided a listening ear to anyone who wanted to tell me what was on their mind. I was privileged to get to know many of them on a very personal level, which led to meaningful discussions. We also identified and worked towards individual goals. For example, one teen was overweight but didn't know where to start to lead a healthier lifestyle. So each day we completed a workout video and discussed healthy food choices while eating lunch together. And then I also created group activities that promoted a healthy lifestyle, physically and mentally. Each morning we completed a yoga class from an online instructor, and then the afternoon activity was always different. Examples include guided meditation, health-focused trivia games, and practice with meal planning. We also visited a horse farm, which was pretty fun. And then my project is the Heart Binder, which stands for Healthy and Engaging Adolescent Resources and Tools. For each activity, I documented the goals, the materials needed, and the detailed instructions. And individual mentoring resources were also documented. Creating this inventory ensures that anyone can lead an activity without having to reinvent the wheel each time that there's a new volunteer or intern. And I would like to thank David Durr for the resources and guidance, the Meekum House staff, and Catherine Widener for their contributions to my activities, and the youth at Meekum House for welcoming me into their lives.
Hi, my name is Andrea Oliver, and I was partnered with Lighthouse New Beginnings this summer. It's a nonprofit that takes care of girls in the foster system and provides housing. So a day in the life for them looks probably very similar to what a day in your life did as a teenager. Some of them have outside jobs, others choose to work in the summer work program, which I'm a part of. And we do recreational things as well, like swimming and biking and lots of Uno. And as part of my project, I offered fitness classes. Okay, so the summer work program is really an opportunity for the kids to make some money. They, for 4 hours a day, are partnered with Community Gardens in Madisonville, which you might know is a food desert and has some people who are experiencing food insecurity. So the girls would tend to plants, they would pull out small trees and mulch pathways. It was a really great opportunity for them to interact with the community, to learn a lot about how to grow your own food, and also learn about fiscal responsibility, because for some of them, it was their first job. I also offered fitness classes as a recreational thing. A lot of the girls in the house are very health conscious, and this is partially due to the fact that a lot are on appetite or metabolism, medications that might affect those aspects of their life, like birth control or mood stabilizers, and they would utilize gyms like Planet Fitness, which with COVID they can no longer do. So my goal with the fitness classes was to provide them a way to continue working out, but do it without any equipment. So I kept the workout short, under 20 minutes, and they were all body weight, so old-fashioned calisthenics like push-ups and running and squats. And I got a pretty good response for that. So I told the girls I would be presenting to you all today, and I asked them, what are some things you wish the medical community or the community as a whole understood about you that they don't? And I'd like to read some of the responses they gave me. I feel like people see foster kids as not having family, and that's just not true. It's not our fault. We are children. And if they could give a message to a younger version of themselves, they would say, keep your head up. It's going to get really hard, and just breathe. Thank you for your time and this opportunity.
Hey everyone, I'm Jacob Waldruff. Like Anna and Andrea, I was with Lighthouse Youth Services this summer, so a lot of this will sound very familiar. I was at the Youth Development Center specifically. Let's see if I can go to the next slide. Okay, so YDC is a home for teenage boys similar to the Meekum House and New Beginnings who find themselves without a home for a variety of reasons, be it because they're fleeing abuse or have had trouble navigating the foster system. And the end goal really is to teach them, so a lot of them will stay for a year or more, and the end goal really is to teach them the skills that they'll need to navigate life after YDC through group and individual therapy sessions. So on a normal day, I would get in at 8, make sure everybody is ready to go where they need to go. And then the bulk of my day, like Andrea's, would be spent on the summer work program. And then we would take the afternoons to do more fun stuff like playing basketball or going to the park, going swimming. And twice a week, I participated in their group therapy sessions as well. So the work program was the most fun that I had while at YDC. It was 16 hours a week, paid work, like Andrea said, and it was partnered with a group called Groundwork, which does a ton of great environmental justice work around Cincinnati. Specifically, we were in Madisonville, maintaining community gardens and mulching trails, pulling weeds at parks, stuff like that. And really the goal of that, I think there were 2 goals. One was to, give them the experiences and skills they would need for jobs in the future, but then also to show them the importance of contributing to the communities that they live in. For my project, I wanted to help them realize that they could apply the skills they learn in one area of their life to another area. So we took what they learned at the work program and made a small garden at YDC, which we used to talk about nutrition and also just give the boys a feeling of ownership over something at the home. So quick acknowledgements. I want to thank Eunice and Maddy for navigating a tumultuous summer and everyone at Lighthouse and Groundwork for all the incredible work that they do.
Hi everyone, my name is Malia Schramm. My pronouns are she, her, they, them, and I worked as an intern at Off the Streets this summer. Off the Streets is a 3-phase residential shelter for women who have been trafficked. The program focuses on recovery and has individualized case management, with many receiving substance abuse treatment. Cincinnati Union Bethel is the parent organization of Off the Streets, and it's the longest continuously operated social service agency in Cincinnati, and it originally provided religious literature to sailors. Off the Streets serves a diverse demographic of women. 97% enter unemployed, 61% have mental health diagnoses, and 84% have survived drug and/or alcohol abuse. My summer internship, I worked on daily tasks when on site, which was originally 2 to 3 days per week and then has since cut down to being entirely remote. I have worked at home primarily on a resource guide, and when I was in person, I worked on daily tasks such as temperature screening and discussing life skills with the women. As I mentioned, my project is a resource guide. The Off the Streets Center moved in 2015 and has not had a singular unified resource guide since then. So in order to simplify and streamline these resources, I researched each organization and formed a new guide. It's about 340 organizations in total and encompasses health, wellness, police districts, anything and any number that they could possibly need to provide education to people within the organization and outside of it. I also created a 4-session health education curriculum, as a lot of the regular health education classes were canceled due to COVID-19, including an education session on COVID-19. I would like to thank Beth and Vianne at Off the Streets for helping educate me on trafficking services and the incredibly kind and thoughtful residents at Off the Streets. I'd like to thank Ben Hood for collaborating with me on the resource guide, and a huge thank you to Eunice and Maddy for being so supportive of me this summer.
Hi, everybody. My name is Ben Hood, and I was working with the UC Department of Family and Community Medicine this summer, primarily at the Racetrack Clinic, and my main project there was similar to Malia's. I was developing our community resource map to make sure that it had kind of the most up-to-date information, with the main goal of increasing engagement with some of the health-related resources that already exist here in Cincinnati. So with the intention of distributing that directory as widely as possible to the people who need it, we came up with the idea of doing this QR code to make it easy to search for and download the app onto your smartphone. But first I want to talk a little bit more about the map itself. So as you can see here, it features downtown Cincinnati, but it includes a lot more than that. It includes around 120 other organizations as well. All the services that they provide, contact information, bus routes, things like that, so that you can kind of easily locate it by category. And it includes a lot of new community partners and programs that were just added this year. So we try to keep it as up to date as possible. We distribute it to our community partners as well at the end of the year so that they can give it out to their clients also. Now, the app that I mentioned is basically a reflection of that resource guide. It was developed by a previous UHP intern, but it includes some additional features like the meal schedules for some of the kitchens, as well as navigation functionality built right in so you can get to where you need to go. Finally, I want to talk a little bit about the clinic. This is the racetrack. That's the clinic all the way on the back there. And this is really our opportunity to treat patients who have limited access to healthcare. It could be financial or transportation or language barriers that they're facing. But it's really great because we get to engage with them on some feedback on the resources that we've been working on this summer. So some of the challenges we've run into include the temporary or permanent changes due to the pandemic with programming that's reflected in the resource guide, but it's hard to kind of reflect that in a printed permanent resource that gets published every year. So that's why we're really pushing for the QR code and the app and trying to get people engaged with that because we find that they get a lot more use out of it. For the sake of time, I won't read every name on here, but Dr. Kiesler, Malia, Alex, all the previous and current UHP interns who helped me out getting this project off the ground this summer.
Hi, my name is Anna Marino Sarah, and this summer I interned with Tender Mercies, an organization in Over the Rhine. I was at their new building that recently opened in March. It was called 821 Flats, or is called 821 Flats, and it serves adults who have mental or physical disabilities, mostly mental illness, who previously were homeless, but they provide housing for them long term. So each morning I would do a walk with the residents. It was a group walk. It was a great way to like get them out and moving. It also was a good way to build community. I found that a lot of people didn't know each other yet in the building, just being such a new area or a new facility. So that was another hidden purpose of the activities that I did. And then each afternoon, I would do a different activity dealing with physical or mental health. We used the UHP funding to plant succulents and paint the pots that went around them. And a lot of residents said that they loved to take care of something, and it really helped them feel a sense of purpose. We also did a George Floyd poster painting session and discussion, which you can see in the bottom of the poster there. The residents really, really enjoyed that, which I was pleasantly surprised. So in general, the main thing that I learned was just that there are so many different people that become homeless due to mental health issues, and their like stories are so different. For me, I also learned like when to take a step back and when to engage, just to make that sort of community work much more sustainable for myself in the long run, because it is something that I would like to do in the future. Overall, I would like to thank Mary Grover and all of the people at UHP for making this possible. Thanks.
Hello all, thanks for joining us tonight. My name is Kirsten Woodyard, and this summer I worked at Welcome House Shelter, Northern Kentucky. Welcome House is an emergency homeless shelter for women that utilizes a low barrier model. It's intended for temporary stays with the goal of the rapid rehousing of the residents. And currently right now, due to COVID, we're only at about 1/3 capacity. So we have around 16 women and 1 child staying in the shelter right now. The low barrier model essentially means that while some shelters may require sobriety or clean drug screen in order to stay at shelter, we do not require that. So while residents are asked to not bring in any drugs or alcohol in order to support other residents' sobriety, they will not be asked to leave if they are found to be intoxicated when entering shelter. This model essentially focuses on removing as many disqualifying factors for residents to stay there in order to allow more people to access emergency housing services. The rapid rehousing program at Welcome House provides rental assistance so individuals and families can move quickly from a shelter to living on the streets or into apartment, from living on the streets into an apartment of their own. Welcome House works with specific individualized casework and helps people transition to more stable housing situations, including programs like Section 8. After clients move to their new housing, staff will keep up with them to make sure their income is still stable and that their housing is still stable. So Life After Welcome House, they have some really great outcomes. So 73% of residents exit the emergency shelter to positive housing outcomes in 2018. In 2018, 68% of residents had an income at exit. And in 2018, 42% of residents increased their income after leaving shelter. And 96 households were served with rental assistance, which shortened their stay at Welcome House. The average stay is around 35 days at Welcome House as well. While working there this summer, some projects that I worked on were health literacy counseling. So helping residents look up health information online, knowing which websites are probably more reliable than others for certain health information, making doctor's appointments, finding PCPs, setting up and actually engaging in telehealth appointments. And then another project I worked on was an educational guide and also some cooking classes. So essentially I created an educational resource for the shelter. It included information as the viral nature of the common cold, how antibiotics aren't going to help. It also included a lot of sexual and reproductive health information for the women because they haven't gotten that in their lives up until now. So I also made tacos, guacamole to help expose them to new food and teach them some cooking techniques to increase flavor in a healthy way. I would like to thank Bev Merrill for welcoming me to Welcome House. And I would also like to thank Melissa Blanton and Candace Tsai for helping me learn effective strategies to empower women who are experiencing housing instability. So thank you. I'm the last person.
All right, thank you so much, 2020 interns. We are so proud of the work that you accomplished this summer, and we know that you have learned many valuable lessons that you will carry into your future medical practices. Interns, please unmute yourselves and give each other a much deserved round of applause.
Awesome, congrats guys. So we'll pause now for a brief intermission. We have a little intermission slideshow with some pictures and quotes from the interns this summer. And we will return with our keynote speech from Dr. Robert Neel after the slideshow.
Sunset, bills on my mindset, I can't deny it. Getting higher than my income's breadcrumbs. I've been trying to survive. The glow that the sun gets right around sunset helps me realize it's just a journey. Drop your worries, you are gonna turn out fine. Oh, you turn out fine. Fine, oh, you turn out fine. But you gotta keep your head up, oh, and you can let your head down, hey. You gotta keep your head up, oh, and you can let your head down, hey. I know it's hard to remember sometimes, but you gotta keep your head up, oh, and you can let your head down, hey, 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 hey. I got my hands in my pockets, kicking these rocks. It's kinda hard to watch this life go by. I'm buying into skeptics mess with the confidence in my eyes. I'm seeing all the angles, thoughts get tangled. I start to compromise my life and my purpose. Is it all worth it? Am I gonna turn out fine? Oh, you turn out fine. Fine, oh, you turn out fine. But you gotta keep your head up, oh, and you can let your head down, hey. You gotta keep your head up, oh. No, it's hard to remember sometimes, but you gotta keep your head up. Oh, and you can let your head down. Hey, hey, hey. Only rainbow after rain, the sun will always come again, and it's a circle, circling around again. It comes around again. I say only rainbow after rain, the sun will always come again, and it's a circle, circling around again. It comes around, but you gotta keep your head up. Oh, and you can let your head down. Hey, you gotta keep your head up. Oh, and you can let your head down. Hey, I know it's hard. No, it's hard to remember sometimes, but you gotta keep your head up. Oh, and you can let your head down. Hey, and keep your head up. And you can let your head down. And keep your head up. And you can let your head down. And keep your head up. And you can let your head down. So go. No.
All right, hi everyone. Welcome back to our 2020 Committed to Community event. We'll now proceed with our keynote speech from Dr. Robert Neel. When thinking of who we wanted to be our keynote speaker for this year's CTC event, Eunice and I knew we wanted someone with a dedication to the Cincinnati community, a deep commitment to humanism and medicine, and someone who represents the ideals of UHP's mission. Eunice and I jumped at the opportunity to invite Dr. Neel to speak with us this evening, a UHP alumnus who was born and raised in Cincinnati. Without further ado, please welcome Dr. Neel.
Good evening, guys. Can you see me, Maddy? Eunice, does it sound okay? All right. So I don't know if I can project anything. I don't know if you guys seem to be much savvier at projecting stuff than I am. So I have something to project, but I don't have to.
You should be able to use the screen share at the bottom.
Okay, we're gonna try this and see what happens here. I have a PowerPoint at the bottom. Yeah, I think it's because I have it in full screen mode, Maddy.
So yeah, I would exit out of the full screen.
Okay.
And then click screen share, and then it should be one of the options to click.
Okay, we're gonna try this. We're gonna see how it goes. This looks like it's gonna work.
And then you can click present. Yep, you can click present now, and it should show up.
Will you tell me if it doesn't?
I'll let you know, yeah.
Does it look good?
Yep, it looks great. Thanks, Dr. Neel.
You got this. This is kind of fun. So to give you some perspective, I saw that Dr. Kiesler is on here. Dr. Kiesler, I know, and I saw Charlie Cavallo on there, who's also another alumnus of the program. And this program was around when, in between our M1 and M2 year in med school. I was a little worried Tender Mercies wasn't going to show up in there because that was my site back in 1997, 23 years ago, you guys. But that was a great site, and it's been so amazing to watch it grow over the last 23 years. And I will tell you, we still have a relationship with Tender Mercies where we still actually go to Tender Mercies. We take food to Tender Mercies, and I got my department to actually partner with Tender Mercies to take food. So, all right. I am going to talk a little bit tonight, and I'm going to talk a little bit about humanism. And I actually, I'm still not used to the whole all unmuted stuff. So the fact that you guys can unmute and actually talk and communicate with me, if you're kosher and would like to do it with me, that would be great, because I actually prefer to interact much more than I prefer. I thought I would talk a little bit about humanism and what it means to have humanism in your practice of medicine, which is something that's really important. Now, humanism is one of those words that we don't really we attribute a lot of understanding to the word, but I'm going to ask someone in this group to tell me what they think humanism means. Jacob is unfortunately like right in my line of fire. He's like right, I can see his picture. Jacob, what do you think? How would you define it?
Well, I'm not sure if you'll be able to hear me over my air conditioning, but we'll see.
I can hear you perfectly.
Okay, excellent. I don't know. I guess I would define it as being committed to elevating other people, and committed to service, I guess.
All right. So we've got a couple things there. We've got service, the elevation of the human ideal. Alex, you are right on my line of fire now. Totes, yes, you. So unmute, and what do you think about humanism?
It's just kind of, yeah, connecting to the person themselves, not like all the factors that makes up each individual and unique person, and like respecting that and like cherishing that when you interact with another person.
So you're adding in the individual as an important unit in this. Okay, I like it. All right, I'm going through the pictures now, you guys. This is unfortunate that you're all on the panel here. Tessa, you are right there. You're in my line of sight now. Tessa, why don't you unmute? Do you think you want to add anything else to the definitions we've heard so far?
Honestly, that's about everything that I would have said.
Ashley's now in my line of sight. Anything else? Anyone feeling like you want to add anything else? And you guys can unmute at any time, and just if you want to add anything else. So it's about, humanism it comes from a Latin word which means humanitas, and it really came to the forefront of society probably in the Renaissance period after the Middle Ages. And it was really a concept of benevolence toward your fellow humans. But the part that you forget about and that they don't talk about is it also had a devotion to humane learning. So learning about humanity and learning about medicine is part of that. So learning was a huge part of humanism. The other part which I heard, which is not actually part of the classic definition, but is part of the more modern definition, is that we have a devotion to individuals and to the working with the individual. I will also add that that includes you as an individual. You are part of that equation. It's not just individuals that are outside of you, it's individuals that include you, because you are part of that. And if you guys don't know it, you know that I'm lucky enough, maybe you don't know this yet, because you only got to see my recorded lectures in brain, mind, and behavior this year. I work with the ALS clinic here in town, and I really found my humanism working with ALS patients. I will tell you, I get to serve. I get to learn every single day. And I really have the chance to embrace my own individuality as well as the individuality of the patients that I serve. And for me, that I have found no happier place than in the service to these patients. For those of you who don't remember, ALS is a progressive neurologic disease. It is a neuromuscular disease that causes degeneration of the upper and lower motor neurons so that people actually develop weakness and problems with mobility, eventually developing problems with speaking, breathing, swallowing, etc. There is no cure for this disease. This is a universally terminal disease. So it's unfortunately something that you have to deal with. And so one of the things that I faced at the very beginning of my career was, why did I choose this? Why would I choose a career where all my patients will die, where I'm not going to get to cure anything and I'm not going to get to help people? And for me, I really thought, why did I do this? And I reflect back to a patient in 2003, and we're going to call her Anne. That's not her name, but we're going to call her Anne. And I first met Anne. She came into my clinic with Dr. Quinlan and I, and she came in with her daughter, Sarah. And these two women were in my office, and Anne was unable to walk. She was unable to use her arms much. She was sitting in a wheelchair, and she was crying. And her daughter, who was no longer able to work because she had to take care of her mom full time, she had to take care of her mom. She had to help her mom to the bathroom. She had to help her mom feed herself. On top of this, Anne, the patient, also had something called pseudobulbar affect, which is one of the most unkind things I've ever seen. Pseudobulbar affect is like emotional incontinence. It's basically your inability to control your emotional response. So people actually can't control their laughter, can't control their crying, and they might cry when they're feeling happy. They might laugh when they're feeling sad. They might cry when they're not feeling anything. And they might just cry too much when they feel sad. So it really is like they can't control the floodgates of their emotions. But it's so bad for some people that when it starts, they can't control their breathing, they can't eat, they can't control their talking. And so it really can be disabling. And so I sat there and I kept thinking, here's this woman who's losing every part of herself. And I mean herself. And I didn't know what to do. I did not know what to do as a physician. I didn't know how to help her. And I knew that she was going to be facing death in the next 6 to 12 months. And I didn't know how to help her get there. And you know what I actually felt when that happened? It made me angry. It made me very, very angry. And it changed me forever. And I still remember her to this day. I still remember her exact full name, everything about her, because it galvanized me and it made me realize I need to make a difference. And I need to make it better in my own community. And I need to make it better for the people that we serve here. I'm not a fancy researcher. My brain doesn't work like that. I'm good with N and I can do p-values and all that stuff. But what I really enjoy doing and where I feel gifted is my service to my fellow man. And so that's where I put my energy. And then I spent the next 15 years building an ALS clinic. And so we had a full ALS clinic that was running by 2012. It was the first full multidisciplinary clinic in the region. And it has been my pride and joy. And we are now in our 8th year, and I continue to serve there. But that's not what I want to talk about today, because all of you, I have a feeling, have a strong sense of justice and a strong sense of service. So instead, I want to give you some advice about some things that you might consider doing on your path that might help you. And this is where I have my slideshow of power. So I'm going to flip through some pictures again. Oh dear. Where's Anna Marie? She was in here somewhere. I saw her in here. And I see Grace. Grace has actually been to my house, you guys. She came here for dinner when we were still allowed to have dinners with first-year medical students. Grace actually got to come over and have supper here. So, all right. Let's go through here. So the first thing I want to talk to you about is something I call care endurance. Has anyone ever heard of care endurance before? Hazard a guess. Matt Altman, I see you. Actually, Grace Kelly is right on my line of sight right now. One of you two, what do you guys think?
I feel like care endurance is maybe like how much you can give to another person before you yourself start to just like fatigue. I don't know.
That's a great way. That's a great explanation. There really isn't a great literature on this. A lot of the literature comes from nursing and from the military. Believe it, those two areas have most of the literature on care endurance. But it's something as physicians that you need to be very aware of. You have a long path in front of you. I expect all of you to be working for 40, 50 years and to be taking care of people as long as you can. Even when you retire, you will still work. You will still care for other people. You'll be an advocate. You will teach. You will do something. And I need to make sure you all have thought about this and how do you protect yourself along the way so you don't burn out, which is a huge problem for physicians and caregivers of all types. So care endurance, we're going to start there. So care endurance, I always think is, I think it's like running. I think that's probably the best way to say it. For those of you who are runners, you don't start out running a marathon. You start out running, 1 or 2 miles a couple times a week, and then you slowly build up. It is exactly the same in medicine. And you need to slowly expose yourself to the people you're taking care of, their problems. And as you get more and more comfortable, you can go into more and more depth. So that might not mean that you go right into the deepest of the problems the first time you meet someone. It might also mean that you can't handle talking about death and dying on that first visit, but you'll get there. And, it took me about 10 years in my career to get to the point where I could see predominantly ALS patients, where I see almost all ALS patients now. I have a few scattered patients that I've had from the last, 15 years that are general neurology, but I really have had patients that are ALS predominant. And I had to build the endurance for that. I did a lot of crying at the beginning. I did a lot of trying to find other things to do with my life to get away from it. And then now I'm at that point now where a day of taking care of patients all day with ALS doesn't faze me. And that doesn't mean I don't feel, which is one of the things that I really want to tell you guys is I'm a highly emotive creature. I feel all the time. When you don't see me crying in the office, it's because I practiced that and because I've actually worked towards it, because I know that I need to be the strong face. A lot of times for my patient, they didn't come, they can do crying with someone else. What they need from me is help. And my job is to give them the help that I can give them while we're together. I will tell you, my residents oftentimes come out of my rooms, just don't feel bad about this, crying, because they're being faced with such things. And I tell them, let it out, get it out, and then get back in the room because I need you in there problem solving. You need to think about how to help this patient with drugs, with therapy, etc. Again, I really do want you to think about it. I don't want you to think about yourself as that you are becoming callous to it or not feeling. I still cry all the time. I had a patient who died on me on vacation who looked just like my sister, dead on. And I wept when she died. And to me, that was really still important to me that I can still feel. And I hope you guys will still feel every day that you're taking care of people, every day. So, but you're gonna find techniques like biting the inside of your lip. That's a great one that I still use to this day. Like when I feel it coming on and the tears coming, I bite the inside of my lip a little bit. My inside of my lip isn't very pretty anymore. The second one is this one, which is I want you to accept your selfishness. And this is part of the humanism that I don't think that other people are going to talk to you about, is you need to accept your selfishness. And I really use the word selfishness, not in a pejorative way. A lot of people will say selfishness is a negative word. And I want you to view it as something that's important to you so that you remember you are part of the equation. You are part of this team and you have to take care of you. If you go down, you're not there for your patient, and that can be emotionally or physically. So you need to be able to take care of yourself during all this. I think when I was your age, I had this misconception that doctors were these white knights. We were riding in on horses and saving the day. And in my world, that was a safe feeling. And I thought I could do this. And then I got deeper into it. I was like, oh my gosh, I can't do this. I am not that white knight. I'm not that guy. And then I had a mentor who I love, who told me about a time when he had hit a patient because he had lost his cool. And I thought, oh, here's this person who I equate with sainthood, who is not a saint. And I just thought, we're humans. And so part of this is I want you to accept that selfishness about yourself. I keep hitting the wrong button here, you guys. It's coming. Happy pictures are coming. For me, I call it the selfishness quota, which means you need to take time for yourself outside of work. You need to make sure you're doing vacations. That means you need to spend time with family. Right now it's hard. This is a horrible time, you guys. I hope you're learning Zoom and Ring and FaceTime and Facebook Messenger video and every which way that you can connect with the people you love. Go out on the porch and scream at them. Do something, but see people that you care about. For me, it's, gardening. That's me with Dr. Wexler there and my husband, Jeff. We like to travel. And Dr. Wexler likes to bike ride. You guys aren't going to get to meet Dr. Wexler because she is retired this year, but she would have taught your cardiovascular block. But she is one of those amazing people. I like bourbon. So there's a couple pictures of bourbon there because I think you should be able to have a highball after a long day. And those are my silly dogs who are now geriatric. Isn't that quite fun? But accept this period, guys, because you really, if you don't have these rest periods in between, you actually won't be able to like build the muscle. In muscle physiology, you know that muscle breakdown actually is necessary to build bigger muscles. So it's part of building that care endurance too. A story that goes along with this is I didn't think I had the endurance to take care of everyone. And there was a night I had a patient who was dying. She was in hospice, in an inpatient hospice unit. And her husband called me. It was January 23rd. It was a horrible night. It was sleeting, raining. He said, we just need you. And so I thought, my husband's out of town. I got to take care of the house. I got to take care of the dogs. How am I going to do this? And I went home, had a peanut butter sandwich, and got back in the car, and then went and saw her. And I was angry a little bit on the way. And then when I got there, I was actually okay. And I spent an hour and a half with her at the bedside. I lost track of time. I had no idea what time it was when I left. I think it was around 9:30. And I really think it was because I had made time for myself in some other places. Maybe it was a weekend a month ago, who knows? But I had that energy to actually take care of her that night. So please remember to make some time for yourself and make sure it's sacred. The next one. Now this is probably one that I think is incredibly important. Do you guys know the 4 basic principles of ethics in medicine? You've learned these in Physician Society, but autonomy, benevolence, non-maleficence, and justice. I think these are really important. All of you in the course of your careers will find that one of these sings to you a little bit more than the other one. And you'll find that one of these actually guides you. I will tell you, for me, I found that it was justice. Justice is the one that it rings my bell. It gets me fired up. And many of you probably feel that same feeling where you see something that's not equitable and you feel like it should be. That's where you drive your energy. And that need for justice will drive you. It will always be in the back of every patient visit you have, trust me. But sometimes it comes out more than others. And this is probably the one that comes out more than the other ones. Try and figure out which one that is for you so you know and you can recognize it. One, so that you can use it for the forces of good, but also so that you don't let it control you. Because it can also, if I was just always questing for justice, I would forget to do right by my patients sometimes. Sometimes doing right actually and being just, you have to take a slight step back. And that's a hard thing to do sometimes. Now this one I think is probably, one of the most important ones. Can you see these guys? So humor. I love to laugh. I think laughter is probably one of the most important care endurance tools you have, which is, I like this one. According to this BMI chart, I am too short. And then the one with the OCD decision, this is me at the gas station. This is 100% me at the gas station. But for me, humor is, it's a gentle solve for me a lot of times. I will tell you it's hard sometimes to have humor at work. You're gonna have to gauge where humor is acceptable, and you're gonna have to learn to read your patients. Not all of your patients are going to enjoy your humor. I bet each of you have a fantastic sense of humor that your friends love. But not all your patients will love it. And you have to find out which parts of your humor and their humor mesh, and where can you make it work. The next one is you guys have to take advantage of each other. You have to realize that your partners in healthcare, whether they're doctors, medical students, residents, nurses, respiratory therapists, it doesn't matter. Any of us that are involved in this are actually your partners in healthcare, and we are your brothers and sisters. And the sooner you learn it, the better. And so you have to think of each other as brothers and sisters. That doesn't mean you're not going to get mad at your brother sometime. Trust me. There's going to be times when you're mad. But for the most part, you're going to be happy. That means you need to talk to them. I always say you need someone to be able to express when you feel like you've made an error, and you need to be able to express to someone when you feel like you've had a success. You have to do both, the good and the bad. If you keep it all inside, you will explode. It's part of that care endurance. So this is Dr. Wexler dressing up as Sia for Halloween, which I loved. She wanted to go to Halloween, so I took her for her, I won't tell you which birthday it was, but for her birthday, I took her to a Halloween party in Provincetown. And then Dave Leonard is my best friend. He's the gray-haired one. And he was he actually did the mobile van back in 1997 too with Urban Health Project. He's a psychiatrist now. The last one, guys, is probably a little bit harder, which is I think you need to accept and mourn the relationships with patients that you have. Again, I'm a little different. I know my patients are going to die on me and usually a set time. But if you go into primary care, even children, even in pediatrics, you will have patients that will die on you. And you need to be able to have friendships and relationships with them and then appropriately mourn those relationships. You need to be able to actually take the time to mourn it and to cry about it. I'm a crier. I don't, some people actually aren't criers, and people get to figure out who they are, but I'm a crier. And she was someone who had my cell phone again, would text me. She would make fun of things. She and I dressed up for Halloween one year because we had a patient visit actually on October 31st. So she dressed up as a blueberry and I dressed up as a nun. And then she loved baseball. This woman could quote baseball stats like you could not believe. She was the son my dad wanted. She really was, because my dad loves baseball and he got me instead. So she was fantastic. The highlight of her life was when she got to go to spring training in Arizona with the Reds and she snuck into the men's locker room. That was one of her favorite moments. And she told me all about it. But she slowly died, and she died on me. And I had a lot of emotions about it. She was a healthcare provider just like I was. She was a fighter. She was a warrior for health, really. Cared for patients for a long time. And I will tell you that I'm stronger because I knew her. And I feel good about it. I feel sad, but I feel good about it. And I hope you guys will take the time to get to know your patients and mourn them when you do, because it really will help you. So her twin sister and I still text every year on their birthday and on my birthday. We always text. So we get a twice-a-year check-in with each other. And I still watch their family grow and see how they're doing. But yeah, it was an important lesson for me. I'd always been told, don't be friends with your patients. Don't do it. And it's not true. You just have to figure out how to do it so you don't get lost. And you also have to remember that you always have a slight power gradient different than other people, and you don't take advantage of it. You just can't. But that doesn't mean you still can't be friends. So on that note, guys, I'm probably going to stop. But I really want you to think about your care endurance like you would think about running long distance. I want you to acknowledge your own selfishness and not run from it. It doesn't mean fall and succumb to it, but don't run from it. Make sure you remember your ethics. Find humor every little place you can find it. Use each other and talk to each other. And I hope you will always love your patients like your brothers and sisters. I know you guys will. I have loved watching your generation. You guys are amazing, truly. Such warriors. So thank you, guys. Thank you for your attention. And hopefully I wasn't too long. Oh my God. Maddy, why didn't you stop me?
I'm sorry. It was just, we really appreciated it and it was great. So we didn't want to stop you.
Maddy, I'm sorry.
No, it's okay.
Thank you, Dr. Neel.
I'm going to stop sharing, Eunice.
Thank you so much, Dr. Neel. All right. So we have had a wonderful cohort of interns this summer, and it is so exciting to see all the positive work that you all have been able to do in just a few weeks. At this time, we want to recognize a few of these interns with awards. After each recipient is announced, please feel free to unmute yourselves to give them a round of applause. The first award we'll present this evening is the Outstanding Service Project Award. The Outstanding Service Project Award is given to an intern based on the nominations of their peers. The interns reviewed each other's posters and nominated one of their peers who they feel went above and beyond in their internship this summer. I am pleased to announce that the recipient of this year's Outstanding Service Project Award is Matt Outmit, who worked with the City Gospel Mission.
Wow, thank you guys.
Awesome. Congrats, Matt.
Thanks so much.
You're welcome. So our next award is the Continued Excellence Award. This award is given to an intern based on the nomination of their site supervisor. The award is given each year to an intern who has displayed superlative work in their summer internship. The recipient must go above and beyond the expectations of their site supervisor, show consistent professionalism in working with staff and volunteers, and through their hard work, make a lasting contribution to their community partner and client population. This year, we will be presenting the Continued Excellence Award to 2 interns who have both shown precisely these qualities. Above all, these interns have set the bar high for what an intern should be. It is my pleasure to present the Continued Excellence Award to Anna Marie Nocera, who served at Tender Mercies, and Anna Edwards, who served at Lighthouse Meekum House. Also, we apologize, but we had to stalk you on Facebook to get these photos, so. Congrats.
Thank you very much.
Thank you.
Congrats, guys. Okay, so our final award of the evening is the Committed to Community Award. The Committed to Community Award is given to an intern based on the nomination of their site supervisor. The recipient of the Committed to Community Award must display both a deep passion for service and a commitment to addressing the needs of the clients at their service site. Above all, they must embody the vision of UHP, both striving to understand the many factors that impact health and improving the lives of all populations, especially the underserved. It is my pleasure to present this year's Committed to Community Award to Alex Gelati, Ashley Mills, and Kyler Wilson, who served at Crossroad Health Center. Let's give Alex, Ashley, Kyler, and all of our interns another round of applause.
Thank you.
Congrats. These pictures were extra creepy because we had to find them off of GroupMe. Alrighty. So this will conclude our evening's program. To our 2020 UHP interns, we thank you for dedicating your summer to service, especially in a time of such uncertainty and chaos. We are inspired by your hard work and passion for bettering our community. Eunice and I have enjoyed reading each of your weekly reflections. We appreciate your willingness to be transparent and share all your meaningful encounters, powerful stories, and lessons learned throughout the summer. To our 2020 service partners, we cannot thank you enough for opening your doors to us. You've set the bar for hard work, compassion, patience, and openness to all people. We are fortunate to be able to spend our summer learning to walk in your footsteps. As future physicians, we hope to carry our lessons learned from you into our medical practice one day. To our 2020 donors and funders, we thank you for helping to make this summer possible. Without your generous donations, it would be improbable that our interns would be making the impact they are today. We are so grateful for your continued support to UHP.
And before we say goodnight, we would like to acknowledge the people who made 2020's Committed to Community event possible. To our Board of Advisors for their gifts of support and guidance to this organization. To TriHealth for their generous donations and support of UHP events. To Eric Wallace for his work on improving the UHP website. To Trevor Fritz, Daniel Brummett, and Christy Wilson for helping us whenever we had any questions about UC finances. To Katie Arce and Dolores Dotson of the UC Foundation for their efforts to maintain the long-term viability of this organization. To Cedric Ricks for his assistance in advertising UHP events and sharing highlights from intern experiences. And finally, to Namratha Kaler, Isaiah Noel, Christian Adams, Sarah Smith, and the many previous co-directors for their past leadership of Urban Health Project and for their ongoing work furthering its mission.
Let's give another round of applause to all of our interns and to Dr. Neel for his amazing talk tonight. You guys are all amazing. So yeah, thank you all for attending and helping us to celebrate the work of our interns and partners this evening. We hope you enjoyed learning more about UHP and the work we've done over the summer. Please feel free to continue looking through our interns posters on our website, urbanhealthproject.org. You can find the link in the chat. Thank you again, and good night, everyone. All right.
Well, you done me and you bet I felt it. I tried to beat you, but you're so hot that I melted. I fell right through the cracks. Now I'm trying to get back. Before the cool done run out, I'll be giving it my bestest, and nothing's gonna stop me but divine intervention. I reckon it's again my turn to win some or learn some.